Diagnosed with bursitis, still having pain, not knowing what to do, tired of being in pain? You got to check this video out first. What's up, everybody? I'm Dr. Matt Maggio, and I'm the creator of the Peak Method and the founder of Soft Tissue Revolution, and I'm on a mission to make chronic injuries obsolete. In this video, I want to dive into the diagnosis of bursitis. The diagnosis itself is a bunch of nonsense. Anything when it has an itis on the end, it's usually not clear. In order to fix a problem, you have to know exactly what the problem is and know what's going on, and bursitis is not that. You have to have a tissue-specific diagnosis of what's going on. So I wanted to dive in a little bit more about bursitis itself, why it's such a common diagnosis, and why it actually leads you down a path of more pain, more frustration, and not getting your injury fully fixed. So bursitis, just by the definition itself, pulled up on old Wikipedia or the Googler, inflammation of a bursa, typically one in the knee, elbow, or shoulder. I'll add that as the hip as well. So, okay, inflammation of the bursa. Like, that doesn't really tell us a lot. It just tells us there's some swelling in there and things aren't. So let's go a little bit deeper and see what the Mayo Clinic has to say. Well, this guy looks like he's just not happy. Looks like he's got some fluid filled in there as well. So, inflammation of the fluid-filled pads, also known as the bursae, that act as cushions at the joints. Bursitis occurs most often at joints that perform frequent, repetitive motion. Symptoms include pain, swelling, stiffness. Common areas include the knees, shoulders, elbows, and hips. Treatment includes rest, ice, and pain relievers. Surgery is rarely needed. Well, it's good when surgery is rarely needed because it is definitely not needed in many, many circumstances. I even have this chart in here to remind people that you really don't need surgery. All it is a waste of money. But that's not what this video is about. We struggle in the current medical model, and everything that we diagnose is based off whatever the insurance company is going to cover. And bursitis itself is not a diagnosis. It just tells us that something's wrong in swelling. So what happens is when you don't know what a problem is, you get nonsense in junk box treatments. And a common fix for bursitis is let's just inject it with cortisone and see what happens. It's like, what the hell is that even going to do? It's actually going to make things a lot worse. Now you have rest, ice, compression, elevation. That shit doesn't work either. Everybody knows that. You've tried that. Essentially what happens is you do that rest, you do that ice, you do that compression, you do that elevation. As soon as you get back to the activity, that bursitis comes back. Now you have to start asking the question of, why am I having the bursitis in the first place? That's what we start to figure out. And all our practitioners are trained in the Peak Method, where they go really deep and figure out exactly why that's happening. We ask questions about why, so we can get down to what's called a tissue-specific diagnosis, and we know why that bursitis is happening, so we can actually address it. So the symptom is important. It lets us know there's a problem there, but if we don't improve the function, we're not going to get any long-lasting results. So if you've been diagnosed with bursitis, tendonitis, anything with an itis in there, it's not telling you anything. And I bet you got some pretty lousy and pretty crappy treatments and you're still in pain. You need to ask questions. Why do I have bursitis? Why do I have swelling? Usually because there's more injuries in there deeper. There's a problem with the tendon. There might be a problem with the muscle. There might be scar tissue in there. There could be a lot of things going on. And simply labeling yourself into this junk box diagnosis of bursitis is not good for you. And the doctor or the practitioner that gave you that, they're really lazy too, because they don't want to take the time to actually figure out what's going on. They're just trying to appease the insurance company. So what to do? First off, get away from those doctors that have labeled you with this. You need a tissue-specific diagnosis. Secondly, if you need help, send us a message. We're always here to help and give you some real answers about what's going on with your pain and what you can do to fix it functionally. And lastly, if you know somebody that's been diagnosed with bursitis and they're suffering and they've done cortisone shots, pills, everything, and they're still in pain, show them this video. It will help them. That's all I got for today. Appreciate you guys, and I will see you on the next one. Bye.